Major depression is a mood disorder that reduces a person's interest in daily activities, completely affects his life, and causes emotional breakdowns. Major depression can be caused by hormonal disorders. It can be inherited, or it can develop due to environmental factors such as the economic situation. Emotional breakdowns change the person's eating habits, sleep status, and the way he does daily tasks over time. Even against daily activities such as doing housework, working, getting air, the person begins to become reluctant. The person feels without energy and tired of any activity, and he can no longer enjoy life. Major depression varies according to the cause and symptoms of its occurrence. Determining the type of depression can facilitate treatment. Peripartum, postpartum depression. Peripartum depression is a type of major depression that develops due to increased responsibilities with birth. It can last from a few weeks to a few months after birth. A psychotic depression, in addition to the signs of mental breakdown of major depression, psychotic symptoms occur. Seeing and hearing things that are not psychotic symptoms, hallucinations, are listed as false beliefs, delusion, approaching others with excessive suspicion, paranoia. It has more distinguishable symptoms than other types of depression. Seasonal depression. It manifests itself in certain seasons when the sun's rays dis. It is usually more common in autumn and winter. Melancholic depression. It is a type of depression that expresses reluctance to all activities that are part of life. The person feels extremely sad and withdraws in on himself. Premenstrual dysmorphic disorder. It is a depression that develops in menstrual women that can last for several weeks. The increase in appetite, exhaustion, irritability that develops during menstruation may be due to premenstrual dysmorphic disorder. What are the symptoms of major depression? Major depression basically negatively affects the mood of the person, and the symptoms occur within this framework. The continuation of the symptoms for more than 2 weeks helps to diagnose. Feeling sad, low energy, feeling of worthlessness, thoughts of suicide, increased sleep time, weight loss or increase for no reason, no longer enjoying previously enjoyed activities. How is major depression treated? Major depression is one of the treatable mental disorders, but since the symptoms are not caused by similar diseases, thyroid disorders, vitamin deficiency, brain tumor, the results of the tests to be performed should be ensured before starting treatment. If the symptoms belong to major depression, the necessary treatment is started by the doctor. Self-coping methods, such as drug therapy, psychotherapy, electroconvulsive therapy, exercise are various methods used for treatment. The most appropriate treatment is decided by the doctor so that the person feels happier and reduces the symptoms. Drug treatment. The use of antidepressant drugs to change the brain chemistry that causes the person's negative mood is common in the treatment of major depression. It may take weeks or months for antidepressant drugs to show their effects, and they may not take effect immediately when they start using them. If deemed appropriate by the doctor during the treatment, the drugs or their doses can be changed. Along with drug treatment, daily activities such as sleep patterns and nutrition begin to get into order. Psychotherapy. Psychotherapy treatment is a method applied for mild and moderate depression treatment. The aim is to change the behavior of the person against the situations to which a negative response has been given and to create a positive response. Depression is taught how to cope by identifying situations that make you feel negative. Electroconvulsive treatment. It is the process of passing electric current through the brain with anesthesia in patients with severe major depression who cannot get a positive response in treatment. Self-coping methods. Exercise, meditation, changes in diet are lifestyle changes that a person can apply on his own, such as changes in his diet. It is applied as an auxiliary treatment to medication or psychotherapy and allows the person to show positive activities for himself. Making positive conversations with the person, expressing his thoughts by writing and seeing the wrong ones supports the treatment by increasing awareness.